Welcome to Module 3 of the 6-module training program for community partners. This is the third and final part of the 3-part training on Medicaid in 2014. Let's review our agenda for Module 3. During this module, we will cover Lesson 5, Renewals, Lesson 6, Post-eligibility, Lesson 7, Classic Medicaid. Let's start with renewals. This screenshot provides a look at how individuals currently receiving Washington Apple Health will now renew their coverage effective October 1st in the new Washington Health Plan Finder. This option, called Renew My Washington Apple Health, can be found on the Health Plan Finder homepage. Demographic information for these current Washington Apple Health recipients will be pre-filled from the ACE's eligibility system over to the Washington Health Plan Finder for a smooth transition. We'll talk more about this later in our training when reviewing how to use the new web portal. Renewals will be processed through the Washington Health Plan Finder web portal for these programs: family, children, pregnancy, and the new adult group. These 4 medical groups will have a 12-month certification period. Please note, for pregnancy medical, the certification period ends after the 2-month postpartum period, and a renewal notice will be sent at that time. Once families have renewed coverage in the first year of Health Plan Finder by completing an application renewal, future renewals will be processed as follows. 60 days before the end of the certification period, an administrative renewal is completed when the eligibility service confirms no change. When there is no program change with the Federal Hub crossmatch, the primary applicant will receive a letter with the new renewal date and a reminder to report required changes. 60 days before the end of the certification period, a manual renewal is completed when there is a discrepancy in the information. In this instance, the primary applicant can log into Washington Health Plan Finder to complete the renewal online, call the Health Plan Finder Customer Support Center to have a Health Plan Finder representative enter their renewal information into the system, or by submitting a paper application. If a renewal is not completed within 20 days of the renewal date, the case will be terminated and a notice will be sent to the primary applicant. Washington State automatically converted some of its existing medical programs into the new adult group for coverage effective January 1st, 2014, including medical care services, ADOTSA, aged, blind, or disabled. The actual auto-conversion took place in the last week in November. These recipients of medical care services, the drug and alcohol treatment program called ADOTSA, and the aged, blind, or disabled program, formerly referred to as the GAX or DLX programs, received a conversion notification letter. This letter notified recipients that they have been auto-converted to the new adult group. Recipients of these programs are not required to make any update in the Washington Health Plan Finder web portal until their next annual renewal. A small group of medical care services recipients were not eligible for the new adult group due to their immigration status and remained on medical care services. Eligibility for these medical care services recipients is determined by DSHS through the ACE's eligibility system and not through Washington Health Plan Finder. Basic Health recipients were notified how to manually convert over to Washington Health Plan Finder. Due to the Basic Health program ending December 31st, 2013, they also received a series of letters beginning in late September, and they need to apply for benefits in Washington Health Plan Finder for continued coverage. Family, children, and pregnant women medical programs must be converted manually. This began with renewals with an end date of November 2013. Coverage must be renewed by submitting an application renewal through the new Washington Health Plan Finder web portal at the time of annual renewal. Now let's review the post-eligibility case review process. Self-attestation will be accepted at the time of application and renewal, and when the family's declared income is different than the automated data match received. While the HCA allows for automated data matching, we know that income information received through verification systems, such as the IRS or Employment Security Department, could be outdated. For example, depending on the time of year an application for health care coverage is submitted, this income information could be up to 15 months old, such as an IRS tax return. For this reason, the Healthcare Authority allows families to self-attest to their income at the time of application and renewal, even when the data match does not match the family's reported current income. With the acceptance of self-attestation of income, in an effort to ensure program integrity, Healthcare Authority eligibility staff will conduct a post-eligibility case review on selected cases. Healthcare Authority will use a reasonable compatibility method to determine which cases are selected for post-eligibility case review. A case will be selected for a post-eligibility review when the automated data match verifies the family's income is higher than the Medicaid standard, but the family declares income below the Medicaid standard. This reasonable compatibility model demonstrates which cases will be selected for post-review. Cases are identified during the data match process and pulled for review. The first category of cases pulled is where the automated data match is above the Medicaid standard and the attested income is below the Medicaid standard. The second category of cases pulled for review is where self-attestation has been used for the eligibility determination as no data match is available. For example, this could happen when a family has not filed their federal income taxes and they have no wages showing in the Employment Security Database. The post-eligibility case review process will include the creation of daily reports of those cases approved for Medicaid but not found reasonably compatible. These reports will be worked by Healthcare Authority eligibility staff. Healthcare Authority eligibility staff will conduct a post-eligibility case review by using a variety of verification sources available, such as the Employment Security Department, TOCS, also known as the work number, DSHS Social Services Programs, and the Social Security Administration. If the declared income is not verifiable during a post-eligibility review, then the family will be sent a request for verification letter. The family will have 10 days to respond. Benefits will continue during the post-eligibility process. Once HCA eligibility staff are able to verify the declared income, the following actions will take place. If the declared income is verified to be under the Medicaid standard, then Medicaid coverage will continue. If the declared income is verified above the Medicaid standard, then the income information is updated in the system. Healthcare Authority eligibility staff will redetermine the individual's eligibility for all other non-MAGI Medicaid assistance programs. If an individual or family is found not eligible for any other Medicaid program, they will be notified of their eligibility status change from Medicaid to the Health Insurance Premium Tax Credit, or QHP. This notification will ask the family to go to the Washington Health Plan Finder web portal to shop and enroll in a qualified health plan. In an effort to prevent a break in coverage, Healthcare Authority staff will attempt to reach the family to notify them of the changes in coverage. This is especially important for changes made towards the end of the month. If there is no response received from the post-eligibility case review request for information letter, then the family will be sent a termination notice for Medicaid. When filing an appeal, a Washington Health Plan Finder applicant may submit a request through any door, including phone, fax, mail, email, online, or in person. Now let's review Classic Medicaid. Medical programs that will not follow MAGI methodology are referred to as Classic Medicaid. These programs include healthcare coverage for aged, blind, or individuals with disabilities, SSI cash recipients, foster care children, those needing long-term care support or waivered services, and the Medicare Savings Program. The federal poverty level thresholds for these programs have not changed. The MN, or Medically Needy Spend Down program, will also continue for the Classic Medicaid population. Those individuals that are disabled but waiting the 2 years for Medicare may be eligible for the new adult group if their income is under 138% of the federal poverty level. For this Medicaid caseload, there will be no changes in eligibility for the Classic Medicaid programs. Eligibility for Classic Medicaid continues to be managed by DSHS. Eligibility determinations and notification letters continue to be completed in the ACES eligibility system. Verification of income and resources continue to be required. Renewal process for Classic Medicaid is not changing. Healthcare for Workers with Disabilities, or HWD, will continue for individuals who are blind or have a disability and are working. Let's now review and summarize what we have covered in Modules 1 through 3. During these 3 training modules, we reviewed general Medicaid eligibility for 2014, described changes to Medicaid under the Affordable Care Act, discussed MAGI methodology including income and household composition, and reviewed classic Medicaid. Finally, we have compiled a set of resources if you have follow-up questions or need to contact someone. Please review the Customer Service Center referral list for the following 4 customer service centers: the Medical Assistance Customer Service Center, the Washington Health Plan Finder Customer Support Center, the DSHS Community Services Division Customer Services Contact Center, and the Healthcare Authority Medical Eligibility Determination Services. For more information regarding the expansion of Medicaid in 2014, we invite you to visit our Healthcare Authority Medicaid Expansion website as shown on this slide. This website will provide you with a variety of resources including training and educational handouts, past presentations and webinar events, and a frequently asked questions page. Congratulations! You have completed Module 3 of the Healthcare Authority Community-Based Training. Please continue on to the Washington Health Plan Finder Healthcare Authority Community-Based Training, Modules 4 through 6.